Morning, everyone.
Good morning, everyone. And it's been a complicated 24 hours. So yesterday already the training sessions were quite intense, but yeah, then you know what happened in the evening. So yeah, we're really sorry, but we're going to keep on being the police even more now. So yes, if we see you without a mask, we're going to keep on reminding you that we really need to think about the well-being of the entire group. So yeah, just think of yourselves and of others as well. We are going to keep on going with the training. As we told everyone yesterday, if anyone is feeling unwell, you let us know and we will auto-test, okay? So this morning, and actually the whole day today is going to be focused on advocacy. So we are here, all of us, to become better advocates for our communities. Wednesday is dedicated fully to advocacy. Tomorrow is going to be about project planning. So before having a session with our colleagues from the World Health Organization that are joining us today, we thought that it would be good to speak quickly about what is advocacy and what is not advocacy, because it may not be that obvious. So you know us already. I think I can pass this one. So the first thing we wanted to ask you is, what do you think is advocacy? What is advocacy for you? So any volunteer, especially we're expecting the former young leaders, the ones who are returning to speak here. Come on, don't be shy today, guys. You were speaking a lot yesterday.
Jatsena, what is advocacy for you? What's advocacy for you?
Advocacy is, for me, is a chance, an opportunity to give back to this community and to make a difference through our own lived experience.
Advocacy for me is advocacy for me is giving back, not just giving back, but also making sure that you're educated enough to give back whatever it is that you're giving back. Yeah.
Does anyone have a different...
Okay, Tino here.
Wait, Bea, can I just suggest that people haven't spoke yet? So we know that we have some people that are really proactive and we admire that, but it would be great to try to hear two different voices. So maybe someone else? Yes?
Advocacy mean connections. This training is example for advocacy.
Advocacy for me would to be spreading awareness or bringing up like a topic that needs to be talked about and giving back to the community in a way that is productive and actually makes a difference.
Someone else?
Advocacy for me is building a support system to the community that we're living in.
Last one.
For me, it's also defending the rights of people living with diabetes.
Okay, so we have a lot of different definitions, let's say, but with a lot of things in common. Building a community, defending the rights of people, giving back to others, and making a difference. That's all correct, actually. That's all part of advocacy, but here is the definition of advocacy. So advocacy is an action by an individual or preferably a group that aims to influence decisions. So we want to change things, mainly decisions which are political, social, or economic. In our context, in the context of diabetes advocacy, advocacy are all actions that us as IDF do and you as young leaders are going to do to affect policies that have an impact in the life of people living with diabetes, but also on people who have risk of developing diabetes, especially type 2. So what is advocacy? Advocacy is about generating policy change, because that's the way in which things are going to change in your countries, by policy, to improve situations that are not fair for everyone. So those are our key words. Let's say policy change, improve, and not fair, unfair. Thank you, Ines. So do you want to explain the examples, Bruno?
Sure. So a few examples. A campaign to gather signatures asking the government to create and improve a diabetes policy. Again, there's this idea of collective change. You can still do and achieve amazing results, amazing impacts, but advocate for your own cause. You still bring awareness, you still bring impact, but you are not thinking collectively. You are not paying back or stealing this term from our colleagues from DDoC, you are not paying forward. A campaign on social media asking policymakers to provide better access to diabetes care. Again, you can still have a social media campaign that you raise awareness, that you have like millions of views, but if doesn't have that specific ask for a political change, that's not advocacy.
And one important thing to mention here. So the first one, a campaign to gather signatures. I mean, normally to generate policy change, you are going to need 1 million, 2 million signatures. Maybe that's a bit difficult for you at the moment. But the second one, having a campaign on social media, tagging politicians, asking them for change, that's something that anyone can do. It requires no budget, and you just need to mobilize your community to do that. So that's something that all of you can already do when you are back in your countries after the training. What is not advocacy? So, if an activity, and again, we are talking about diabetes advocacy as part of the YLD program and IDF, if an activity does not intend to influence a policy change, we do not consider it advocacy. It may be other type of activity, but not advocacy. And we have two main examples that the YLDs normally consider advocacy, but are not exactly advocacy.
So we have diabetes camps, so educational activities to learn more about living with diabetes, normally for young people. However, I'm not saying that you should do that, but if you decide to camp outside the parliament and try to invite your decision makers to take part on that camp, that may be considered advocacy. Another thing, awareness raising activities. So really common around World Diabetes Day or the November, the Diabetes Awareness Month. So to inform and educate people about the topic, to influence their attitudes and fight stigma. Again, however, if you decide to do a screening activity, let's say in your parliament or inside your municipality, like with decision makers, you can turn that just, and I'm using the just here because of course we understand and awareness is super important, but you can turn that just awareness activity into also an advocacy activity. I think it's more how you use it and the target audience of that activity, that the activity itself.
And that leads us to this slide. So which activities are more important? Awareness raising, advocacy, other type of educational activities, all of the projects are important. So whatever you're going to do as part of your YLD project when you are back in your country, all of that is going to be important. One thing that you need to bear in mind is what Bruno is saying, everything is interconnected. So even if your project is not purely about advocacy only, if it's about education, if it's about a diabetes camp, if it's about awareness raising, you can still include a component of advocacy in it. For example, what we were saying, this social media campaign, targeting policymakers, etc. So we really ask you to think about how you can include this advocacy component into all of your projects, because that's what's going to help your community the most. And we are here to help you. Actually, we're going to keep on having discussions today on advocacy, and tomorrow we're going to also discuss about that when we do project planning. And we wanted to have a short discussion with you now before we move to the next session on this topic. So here are 3 questions. What is the main diabetes-related issue in your country? I'm sure that depending of the country, it's a different one, and probably there is even a very specific issue for each of your countries that is different from the rest of the countries. Are there any policies already in place to address this issue that you think is the most important one? And also, the thing is not only if there are policies, the thing is, are these policies working? Are these policies being implemented? Because we know that sometimes there are policies, but they don't work out, or the governments are not implementing them. So that's the same as not having a policy at all. And do you have ideas of what should be done to improve this situation? So we have, how much time, Bruno? I think like 10 minutes.
Yes.
Yeah. So we have about 10 minutes to discuss this. Okay. Someone, a volunteer here already.
Can I do a question, or do I need to ask? Hi, thanks for the presentation. So my question here is, I see that every time that we have been speaking about advocacy, it's active action. I feel like that's an important aspect, that it's to mention the passive action that we can also have. So instead of organizing only campaigns to change something, we can also get involved on a personal level with entities, with city councils, and start to change some things. So if I get on the board of a sports club, perhaps I can institute that there are some routine checks or some things like this. And what I mean is, I wanted to hear your perspective on, besides the active initiatives, what can we do in our everyday life that can count as advocacy as well? Thank you.
Do you want me to? Okay, I think the first thing is that if you want to become a diabetes advocate, I think the first thing that you need to know is to understand the policies related to diabetes in your country. Because, for example, I have here and seen in Brazil people asking or advocating for things that are already guaranteed by the Constitution, or that are not applicable to our Constitution. So I think the first step would be to understand your reality, your environment, in legal terms, like what is the rights of people living with diabetes in Portugal. I think that would be the first step, regardless if you want to participate more actively, more engagedly. And yeah, you are right. I think that there's also lack of representation, it's lack of youth representation. So if you ever have the chance and you have the will to get engaged, politically speaking, not just like on the national level, but on the local level, on the regional level, in any like decision entity, decision body that has the power to implement some sort of policy, some sort of regulation, definitely that's advocacy.
Yeah, and on that note, so we're going to be talking today about where you can find important data for your advocacy, and how to do this research of the evidence that you need to do to have in order to advocate. And another important thing, so Bruno was saying that you can camp in front of the house of the Prime Minister. Well, maybe you don't need to start there. Maybe you can start smaller. Maybe you can reach out to the mayor of your city, or to someone working at the local level, and you can start really by that. It's better to aim to something that you know it's achievable, actually, than being too ambitious, because, then you can be frustrated if you do not manage to get what you wanted.
Okay, so the main diabetes-related issue in my country is, like, when we go to the public hospitals and so forth, I'm a young leader. I'm part of the Young Leaders in Diabetes group in Guyana since the first day. I was one of the co-founders. So, yeah. when we go to the hospital, if you don't ask for like the HbA1c testing and so forth, we wouldn't like get a chance to get them. And so like the doctors usually, like if we're like admitted in the hospital with a high blood sugar or so forth, the doctors at the ER usually tells us that if we run out of insulin or so forth, we can just go at the pharmacy and get them, right? But when we go to the pharmacy, they have like a specific card or yeah, to state that, well, this month you're collecting one vial of insulin and so forth. You can't get any more. So what patients usually have to do is tell them that it broke or yeah, someone did something with it and so forth. You have to lie in order to get it. We can buy them at the pharmacy, but most diabetic patients can't afford to buy the insulin. Yeah.
Okay, so if I understand in your country, then the main issue is, well, difficulty to access care, but also probably healthcare professionals do not have enough education on diabetes. Okay, in how many countries do you think this is an issue? For how many of you? Only? Yeah, healthcare professionals who do not have enough education on diabetes and problems accessing the care and the medicines you need. Okay, hands up again. Sorry. You were just okay, let's do the first one then. Healthcare professionals education. Okay, so about that, you know that the World Diabetes Day campaign this year was about that, asking for better diabetes education. We have on the IDF website a platform in which you can just put your name, your email address, and you can automatically send an email to the Prime Minister and the permanent representation in Geneva of your country. So I don't know if you were aware about this. We have been telling you about this in the biweekly updates, but okay. So you can just check that out. We are like 50 people in this room. If you do that, it's going to be 50 letters sent. If you share that with your network, it's going to be 500 letters sent. So I really encourage you to do that because that's, for example, an advocacy activity that you can do. The other issue was access to care. For how many of you access to care is an issue in your country? Okay, quite a few again, like half. Are there policies in your countries to address access to care? In how many countries there are no policies? Okay, you have a problem there and you know what you need, a policy. So you know that you can, obviously, I mean, your project is not going to end up in 1 year having a policy. This is going to be a longer term thing, but you can start with your small stone, let's say, trying to build something together with the rest of your colleagues.
Thank you. So I'm going to answer the questions real quick, but I also have a question about the strategy that we're following. So the main diabetes-related issue in our country is obviously access to care, but not just to care. It's actually to diabetes supplies and insulin and stuff like that. But there are no policies to address this issue. And do you have any idea? We do have an idea. What we've been working on is us as an IDF member center. We're contacting, we have donations from international communities that give them to our center. But however, this is not sustainable because obviously it's not on a national level and it's just helping around 2,000 patients, not all of them. So my question is to you, when there are initiatives with good intentions that want to help our country, they usually get lost in translation and they hang up in politics, and that's what I said yesterday. And so the approach that we took was us going and contacting the organizations. Is there something else that we can do in order to facilitate that, to make it sustainable? Because it's very hard to get to politicians.
Yeah. Okay, that's a difficult one. And one important thing that you have been saying as, again, advocacy is not about you doing a project. Advocacy is about you collaborating with other people, because the more people working together, the more chances you have of succeeding. As you are saying, donations are great, but that is not policy, and that is not going to help everyone who needs help. The situation in each country really is different, and the way policy development works in its country is also different. So we're going to be explaining to you later today how to, you will need to do a research. What is the situation in your country and how policies are developed? Because in Lebanon, maybe in one way, in Uruguay, maybe in another way, in Guyana, maybe in a completely different way. So the systems are completely different. Advocacy is pretty much like very tailored to the situation, not only the country, but really the specific situation in which you live. So yeah, I think it's something that we need to discuss during the workshop this afternoon, and also during the project planning session. Okay, we just have time quickly for one more, because then we need to move to the session with WHO, but we are keep on talking about advocacy today. So who wants to go? Okay. Okay.
Hi everyone, Kirsten from South Africa. I think our biggest core or issue in South Africa is that it's the #1 killer for women in South Africa and the second leading cause of death for men. And it kills more people than HIV, TB, and malaria combined. So the issue is that there are preventative care policies in place, but to try and change the treatment plans is very difficult. So the only way that we've been able to try and combat that is just to be really annoying and just keep on trying, but we keep being turned away because we have no national data, especially on CGM or new technologies. We have no national data to prove that the device is effective in our country. So although you guys have a lot of global data in the European regions and that, we try and use those policy or that data in our country, but it's always we need the local data. So that's a big issue.
Thanks a lot for sharing, Kirsten. And you mentioned something very important. So you were saying that in South Africa, the main issue is AIDS. The advocacy campaigns of the AIDS community actually have been quite successful. So this is another important lesson. You need to check what has worked in other, not only disease areas, but yeah, in any area that you can think of, because you can learn a lot actually from those people. You can have meetings with them, you can check what worked for them and try to replicate that. There have been some successes out there, so we need to learn from that and bring that to the diabetes world, let's say. Okay, we do not have more time now for the session because I think, yeah, it's just 9:45, so we need to move to WHO. But we are going to keep on working on advocacy all day. We're going to have a session with Mark with a small workshop this afternoon. So this is a conversation that is to be continued. Okay? Thank you, guys. And yeah, we make a short break, just 2 minutes.